Hey, Rick Giannotti here, Healthcare Nation podcast, doing a quick video short on what's new and noteworthy in the health sector over the past 10 days or so. I would say this, a lot less dramatic than the tariffs, but I might characterize it as somewhat diagnostic in that we're seeing some flashpoints. We should kind of track these down, see where they go. If we read them right, I think they're revealing some fragility in what's holding our healthcare economy together. There's a risk to that. Let me start with Pharma, big part of the sector. Look, they're having a political identity crisis. Big Pharma has been a long-standing power broker in DC. They wield the largest lobbying budget in town. They work hand in glove historically with Republican leadership. But that alliance is getting very wobbly. So what's happening here? We know that GOP administrations have supported Pharma's global growth, tax breaks, light touch regulation being some of the tactics that have been out there. But now the Trump administration is threatening tariffs on imported drugs. RFK Jr. is publicly critical of pharma profits and the safety of its products. The usual allies for pharma are now in the question mark category. So my take, look, pharma's fear isn't just about policy, it's about strategy. And when there's unpredictability here, when you don't know who's got your back anymore, it makes it nearly impossible to plan. And without a plan, innovation slows. So does public confidence, so does the market confidence. Let's watch this one. In the ACA world, the Supreme Court is reviewing whether the ACA's provision mandating preventative care coverage is constitutional or not, specifically whether the advisory task force that made those recommendations was properly appointed. Now, this provision has certainly helped millions of Americans with screenings, with access to meds, without out-of-pocket expense. Now, that's a big part, and it's been a big component of effective healthcare delivery and public health policy. But opponents argue that the task force was never constitutionally empowered. This makes its decisions and their financial implications illegitimate. So my take, if the court strikes this one down, it's not just a technical loss, it's a blow to preventative medicine. We'll shift from proactive to reactive care. You'll have insurance companies potentially in the gatekeeper role of what's worth covering and what isn't. I don't know that anyone wants that, so let's watch this. It's a big story that's out there. In another pharma story, the pill penalty and the IRA, right, the Inflation Reduction Act, a part of it was meant to lower drug costs by allowing Medicare to negotiate prices, but there's a catch. It targeted pills, the most accessible form of treatment, for the earliest part of that negotiation and price setting. So look, we all agree lowering drug pricing is vital. So we know that the uninsured, seniors, look, they've been crushed by high drug costs. So you should do something about that. Negotiations make sense. But when you target small molecule drugs, right, pills and tablets, when they face the earlier price caps, it makes them much less attractive for drug developers and ultimately for investors. So my take, it's a policy paradox. We're penalizing the most scalable, affordable treatments, the very ones that improve compliance and access. And without some kind of course correction, there's going to be fewer of these drugs developed, and potentially patients are going to suffer. So let's stay tuned on this. Look, at the end of the day, I see some trends here. We've got a system that's simultaneously over-leveraged, underprotected, and overly influenced. We don't need patches, we need leadership, we need the right kind of policies, and we probably need realignment. So stay tuned, stay safe, and stay healthy, and look for more on the Healthcare Nation, and we'll break it down for you.